Minister of Health has on Monday launched a fogging machine provided to the Banjul City Council through the National Malaria Control Program. The machine is provided to fumigate the capital city, Banjul, to get rid of the malaria-carrying mosquitoes. The CC has more details of that again in this report.
Malaria cases in the Gambia are worst in the Greater Banjul. As a result, the Ministry of Health on Monday inaugurated a fogging machine provided through the National Malaria Control Program to Fumigate Banjul. The Minister of Health, Dr. Ahmad Lamin Samate, said that providing quality healthcare service for the people is a top priority for the government.
But we want to assure the people of this country, and today the people of the city of Banjul, that public health is going to be at the forefront of the strive of this government to provide quality healthcare services for the people of this country. Very soon again, we will see the health inspectors in town inspecting the compounds, inspecting the markets, inspecting the public places, inspecting the streets. And that also used to happen in the city of Banjul here, and it was very useful. So health inspectors will be going around very soon to make sure that our cities are clean and functional.
Despite an intensive campaign against the disease and provision of heavily subsidized anti-malaria drugs by the government, women and children are still dying from malaria. The deputy mayor of Banjul, Omar B.J. Toure, described the disease transmitted by mosquitoes as dangerous.
And malaria is a very dangerous one. Though we are in this COVID, that's why all these diseases are covered because of the coronavirus. But malaria is with us every day, every second. People are dying because of malaria. And when malaria come to your house or to your community, you will not look at the young ones or the elder ones. Even COVID, we are talking about the young ones are the carriers. You're targeting the old ones. But for malaria, you will not spare anybody.
The Minister of Health also encourages people, especially women, to sleep under mosquito nets to protect themselves from malaria.
It is fashionable to sleep under the net. People think it's not fashionable, but as long as it protects us against malaria, I think it is good. So we also want to encourage the women. We want to encourage the women to make sure that the children and even the men sleep under the mosquito net. If the women want the men to sleep under the mosquito net, everybody will sleep under the mosquito net.
Malaria remains a major public health problem associated with poverty, and it is one of the main obstacles to the economy of an endemic country. Among the several complications, the effects of malaria seem to target the skeletal muscle system, leading to symptoms such as muscle contractures, muscle fatigue, and muscle weakness. This can often be prevented by the use of anti-malaria drugs and the use of protection measures against mosquito bites. For iAfrica News, I am Daisy.
Health authorities there to intensify fight against malaria in the capital city, Banjul.